My name is Dane Zahner. I go by he, him pronouns. I am Southern Oregon's prevention manager. I'm going to talk a little bit about our harm reduction program. This is how we help people with Hep C in Southern Oregon. I'm going to give you kind of an overview. A lot of people, our name makes people think it's just about HIV, but we are so much more, and I'll talk a little bit more about that. I'm just going to touch on some of our programs because we have a lot of different programs going on across all 7 of our prevention counties, and then we do case management in 13 counties for HIV. I'm going to talk about harm reduction at HIVAlliance and then our Southern services, and then I'll open it up for questions. But like I mentioned, a lot of our name, HIVAlliance, does make people think about just HIV. And we do care for about 1,200 people living in 13 counties in Oregon. I always just tell people from basically from Salem south to the border over to Lake County, if somebody's HIV positive, they're offered our services. And we do have about 1,200 individuals that need those services. We have peer programs. I'm really excited about the different peer programs. We have that in Lane, Douglas, Coos, Josephine, Jackson, and Marion. Those are harm reduction focused peers that are really helping align with our prevention programs to connect people to care if that's something they want. But it is not necessarily something that they are required to do. But those peers, having them work hand in hand with harm reduction is just amazing. We have free testing for HIV, Hep C, syphilis, in Lane, Marion, Douglas, Curry, Josephine, and Coos County. We do have a student education program that goes into the schools of Lane, Marion, and Douglas counties, and we offer that resource on HIV education, Hep C, and STI, and anything more. We're really trying to encourage schools to have a harm reduction focused education with the amount of overdoses, just understanding the risk. We do outreach to about 3,000 high-risk community members on a year-to-year basis. We probably touch a lot more than that, but that's just what our data reflects. We do syringe exchange in Lane, Marion, Washington, Douglas, Coos, Curry, and Josephine County. And I'm just going to focus really on Douglas, Coos, Curry, and our Josephine County services. A lot of people don't understand harm reduction from HIV standpoints. Overdose prevention is one of the key things that we try to prevent. And that naloxone resource, making sure each of our clients is prepared in the case of an overdose. We also do agency trainings and train the trainers for those agencies, connecting them to Save Lives Oregon for their naloxone resources. Community members, again, we connect them. We'll do the training, connect them to the resources I have available for the naloxone. We're a 1-for-1 syringe with a lot of flexibility, and we want to make sure they get all their new equipment, tourniquets, cookers, waters, cottons. We don't want anybody to reuse anything. We just want to protect them around HIV and Hep C, and Hep C being a major focus of us. But the testing for HIV, Hep C, and syphilis is something we encourage and talk to each of our clients about. When was the last time you test? So if the window's been about 6 months, we would encourage, because they do have a risk, and especially if they identify as somebody that has shared equipment or reused equipment, we want to make sure that they've tested and that frequency of at least every 6 months with us. Fentanyl test strips, they are good harm reduction. Anything that slows somebody down to make them think about what they're about to do, but that it's naloxone resources, we will not give out a fentanyl test strip without making sure that somebody's already ready for an overdose, because that naloxone is going to change the outcome there. We have resources for treatment, medical, and safer injection resources. So, again, a question we ask each and every client: are you ready to embark maybe on a journey of treatment? Or do you just need some resources around safer injections? So we have all that information. And, it's really on how you ask those questions. Again, when we have those peers there on site, it could be HIVAlliance peers over on the coast in Coos and Curry County, it could be ADAPT peers, and we work hand in hand with ADAPT Bay Area First Step peers. All resources that we can connect those clients to. If they say they are ready to make a journey on treatment, we're going to connect that care. Or if we're testing and we have a Hep C reactive, most of those peers are working with the PATHS program and can start their treatment for them. So each client is asked about the testing, the treatment access, and other barriers of need. Peers are involved in 4 counties for the connection to care, especially around PATHS right now. We really want to make sure that people are, once they find going from a reactive test right to that connection of care, and how easy it might be. If the peers aren't there, we're going to help. We can make a phone call and probably do it before they leave that afternoon and connect them to care. Just kind of looking at our testing and what we did last year. An HIV reactive test, we run a second test automatically, and then we can enroll them in care and connect them to our care team. And that typically can happen the same day also. Our intake coordinators are here in Roseburg and our other offices. So from a reactive test to a second test that's also reactive, we can enroll them and connect them to our care team. Last year, and this is just our counties down south here, the 4 counties, 729 HIV tests. We did have 3 reactives. Hep C, again, if we have a reactive test, we're going to immediately do that connection to pass with whoever's running that program, whatever county, if it's HIVAlliance, Bay Area First Step, or ADAPT. But we ran 691 tests. And again, see, we did find a lot more reactives, 64 for Hep C. Syphilis, again, we can do that immediate connection of the PATH programs and peers for access to care. Last year, we ran 555 tests and 14 reactive tests. So actually, the previous year, we saw almost 1 out of every 4 people, because we were focused on the hepatitis C Oregon Hope study. A lot of the peers were doing the testing too. Now it's mainly the prevention team that's doing most of the testing. We saw a lot more. That was almost 25% in most of our counties. Syringe exchange. This is an important piece. This is how we protect our people, and this is how we make sure that Hep C is reduced. We don't want them reusing or sharing equipment. So we served about 166 clients last year in Coos County, about 26,000 syringes. Curry County, 214 clients, and about 16,000 syringes. It's a newer area. So, again, we want to make sure they're weekly services. We want to make sure they're protected. So we typically do about 60 syringes, or if they need more. That's where I say we have a lot of flexibility in our syringe exchange. Yes, we promote the 1-for-1 with flexibility. Josephine County, 992 clients, 105,000 syringes. Douglas County, 2,100 clients, and then about 257,000 syringes. The lock zone, again, this is how we save lives, and I think it's really powerful. As we do more and more refills, that's where we get that important data. But Coos County, 364 clients, 1,040 doses, 26 reversals reported back to us. Curry County, 178 clients, 978 doses, and 21 reversals. Josephine County, 432 clients, 1,695 doses, and 122 reversals. Douglas County, 1,622 clients, 5,700 doses, and then 306 reversals. So we are making an impact. I know this is about Hep C today, but it's also about making sure people are the other most adverse thing that can happen to somebody is an overdose. So making sure they have that naloxone and is ready besides the testing. This is just some of our equipment. This is just Douglas County, and I wanted to kind of show you so that you'd see how much we do and how many areas we test. So Roseburg, we have our office 4 days a week, 11 to 4. People can drop by. We go into Gaddis Park. We do the Roseburg Seventh-day Adventist Church. Connecting point on the Dream Center. We go down to Winston at the South River Medical Clinic. And these are all combined partnerships when we're outside of the office. Sutherland, we're in Hastings Village as a safe camping location in Sutherland, Oregon. Then Glendale, we use a church again, Olivet Church. So it's a great combination where we can work with churches hand in hand to connect to, especially around food banks, has really been a big benefit because they already have community members coming in, and then we can help the at-risk community members. Josephine County, we go into Wolf Creek, Cave Junction, we use the Methodist Church. We also have a multiple partner outreach that goes out into the parks and connects people. Grants Pass, we have testing on Mondays in our office. So all these have the option of testing, and that's what we do encourage our clients. So I'm just trying to show you an overview of how you can successfully connect with people for not only harm reduction resources, naloxone, and then the testing piece and connect them to care. Coos Bay, Port Orford, Brookings, Gold Beach, and Bandon we're also in now. And so get us that collaboration with the community partners and that alignment and that comfortable. It kind of helps overcome some of the stigma when you're using Coos Health and Wellness as churches. Curry County, monthly testing with the Curry County Jail. Again, always having a focus of thinking about testing and how we can connect people not only to the harm reduction services, new equipment, also then the naloxone, but the testing is a key piece, and especially on the focus on Hep C. We are volunteer run, so we're always looking for volunteers, and I always got a plug on the, if you're in one of our areas, we'd be happy to coordinate, and you can just reach out to Desiree. But that is my presentation today. Again, it's so good to be here and talking about hepatitis C. I can remember my third day in meeting Lauren and Jude, them taking me under their wing. And I went back to our offices and said, hey, why are we not more focused on hepatitis C? And look what we've come to today, not only our Oregon Hope study and all that connection to care. Now, almost all the way across Oregon, people can be connected to care around hepatitis C, and that's going to eliminate this disease. So that is the importance of why we're here today. So thanks so much for listening to me. And I hope that gives you kind of an overview of what we do for our services in 4 rural counties. Yes, rural counties across Oregon. Thank you so much.
Dane, you are invigorating. That was so awesome. Are there any questions?
I just appreciate talking about what we do. And we really, I think Joanna touched on a lot of the collaboration, and I cannot overemphasize that collaboration with on the coast, working with Kelly when she was a Bay Area first stop, and Devin and Paul. It's just working with the ADAPT team and Mary's team. It's that collaboration on it's whoever can answer the phone first when we have a Hep C reactive. That really is what it's all about. And Anna and Eric, they stop by and just see what we can do to help, or what they can do to help us, and how to advocate more. And I just think it's that collaboration, and we really have found results of the more we do outreach events. And then now I'm happy to say in all 4 counties we have outreach events, and that just is amazing. And that collaboration of taking things into Myrtle Point, Powers. Have you ever been? Look on a map. You probably don't even know where Powers is. I live in Yoncalla, and it touches my heart when Joanna and them were doing services. And we only have so much capacity, but our dream is to be able to do every small town, because transportation is the biggest barrier to getting to us. But I talk too much.
Are there any other questions?
That's why you're everywhere. Any questions? I thought I saw some questions for Dane in here.
There's lots of love. Everybody's sending love about the incredible work. Folks would like to have something like HIVAlliance in their area. Just lots and lots of support for what you are doing.
I have a question, Dane. How did your bosses break down the silos that exist between HIV spending and harm reduction and hepatitis C and all the work you're doing? How'd they get that silo broken down so that you guys could do this syndemic work?
I think one of the biggest things was the naloxone trainings. And when we were doing the focus on the community and the police trainings, it really helped open the door of understanding. My previous career was 25 years with Kmart. We did shop with a cop. And so this police collaboration, I love doing police trainings. And it's just kind of explaining, we always have a model of what harm reduction is, what our services are. And then I think it slowly just kind of built up a momentum of understanding of we're here to help these people and individuals, and especially with the police departments, is we deal with them with a different perspective, but we're there to support them. And I think it just really is just collaborating with joining every meeting in every county and being there to talk about harm reduction, and being there how you can support people and offer that assistance and help in these areas. So, and Dr. Bob, man, he's awesome. We're in a great county. It's my home county. And those collaborations with the public health is, that's how we make these things happen.
And I just want to add too that HIVAlliance was doing viral hepatitis testing and referring to the LPHA in multiple counties, Lane, Douglas, and Josephine, referring to the public health departments back in the early 2000s for viral hepatitis vaccine access for people who use drugs. So the administration at HIVAlliance was very supportive of very early 2000 efforts to promote HCV testing. At one time, they even thought about changing their names to just the Alliance so that they could, really, or HIV Hepatitis Alliance. There was a lot of things. And I want to give HIVAlliance the long-term history of that agency props. They were one of the first agencies in the state to uptake a syringe drop box outside of their building back in the early 2000s. So incredible work at HIVAlliance over the decades, and it just keeps getting better and better with folks like Dane there.
No, and I didn't even touch, you mentioned the drop boxes and that collaboration in Coos County. We collect 290,000 syringes with 4 drop boxes. It was a collaboration between the fire department and Advanced Health and HIVAlliance. And then the hospital, I mean, they're amazing because they destroy those for us, but that was a new concept for us that we've kind of modeled all of ours. Is like medical waste is a huge issue in that county. And that's another one, like Lauren, you're talking about collaboration, is like, how do you collaborate with community partners? We destroy people's syringes if they're diabetic, if they use them for other medical resources, and also illicit substances. So it's a win. And that really has got a partnership and communication.
That is a big win.
Yep. And I agree that HIVAlliance has been doing this a long time. I think, Anne, we took a trip down there back in the early 2000s with Phyllis Beck. And Phyllis was a advocate for hepatitis C that we lost too long ago, but one of the first advocates in our state that really made a difference in a lot of places. So we miss you, Phyllis. Give her kudos.